We've been concerned this week hearing about this new strain that's been circulating pretty rapidly in the UK. CDC says it's probably here undetected. And I mean, I think it's probably hard to argue against that, right?
That's right. I am concerned, and it likely is here. We have not got the genotyping, the testing deployed widely enough to know whether it's here, but I think that's happening now from what the CDC indicates in the next couple of weeks.
What does that mean just in terms of how we handle this, what the numbers are going to look like from here? President-elect Biden saying yesterday that the darkest days are ahead of us still.
Yeah, here's what to understand about this potential, they call it a variant of concern. This viral mutation seems to drive a faster spread. It takes less virus to cause an infection. At a time where we already are at skyrocketing infection with millions of people infected, the measures we normally take will be slightly less effective in stopping it at a time when our hospitals are already in more than a third of the country full to overflowing. So the main concern is that it will accelerate the surge on surge that we've been having and extend the period of hospitalization and death rates that we've been seeing. What do we do about it? It's still the same practices that really work. It's just it requires an even higher level of vigilance if this does prove to be, and there's a lot more evidence that this transmits more efficiently. Now, it does not appear to cause, as of this moment, and there's still, more monitoring to do, but it does not seem to cause increased death, increased serious illness. And so the main concern is that it's just even more easily spread.
There's a lot of statistics that we've been running through. I heard one earlier this morning about how shopping mall traffic is down significantly from where we were, maybe down 40% from a year ago. But then anecdotally, you see things like pictures of local malls where there are big crowds in the food courts or other places. Or at Newark Airport, Brian Sullivan, one of our anchors, was traveling last weekend and tweeted out some pictures where people were crammed on top of each other for, it seemed like miles, trying to go through security. Are we doing this right or not?
Well, there's certainly signs that people are doing a lot better than a month ago. We see mask use up. We see people restricting how much they're indoors, cutting down on eating with people outside their household in restaurants and bars. And that just has to happen. And that is increasingly happening. And so we're seeing in places that had skyrocketing levels, they're starting to come down in many parts of the country. But there are other parts of the country where it clearly is we're behind the eight ball. Behavior's starting to change, but it's extremely hard around the holidays, and I think we're in for still the surges for another few weeks. We're at 300,000 deaths already. The next 100,000 deaths are baked in with new infections in the last week or so. So it's really about, can we avoid the 500,000 deaths, which is just horrifying to even think about.
Shepard Smith here. Thanks for watching CNBC on YouTube.